This week's class, When Your Health Matters, the class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We're located at 138 Canal Street in Pooler Park. That is in Pooler, Georgia. We're in Suite 404 of Building 400. For those of you who are still reticent to stop into the office, I would encourage you to give me a call directly at area code 845-561-2225. Again, 845-561-2225. That is my cell phone. I'll be the one answering that phone. If you don't want to call the phone directly, please don't text that phone, as that phone does not receive text messaging, and I will never get it, and therefore I'll never be able to communicate with you. But you can email me directly at docrick@spineboy.com. That's DOCRICK@spineboy.com. And it's my pleasure to help you to better understanding what the concerns that you have regarding your health. This class is called When Your Health Matters, and it's not up to me when your health matters. It's actually up to you when your health matters. And my hope is that your health will always matter. And if you've been watching our series of weekly video classes, we're having weekly video classes because people are still concerned about COVID-19, and they're not actually coming to the class that I hold in the office every Tuesday evening at 6:30. So we moved to this format, and if you're watching this and this is your first time, I appreciate you being here. If you're a regular and you're just coming back for your weekly dose of healthful information, we appreciate you being back. This particular class is specifically on your health of your gallbladder. Some might call it your resentful gallbladder. And why would we determine it to be your resentful gallbladder? Well, the chief emotion associated with your gallbladder happens to be the emotion of resentment. And resentment develops when life is giving you something, something that you don't want, something that you didn't ask for, difficult, challenging situation, and you'd like to send it back, but there's no place to send it. Hence, that manifests in the emotion within the body and the response within the body of resentment. And when you get resentment, you're going to have various health issues as a result of repressing that resentment or holding that resentment in, or even if you're expressing that emotion of resentment. Last month, actually 2 months ago, we discussed the health of your liver, which is part of the wood element. It's the first part of the wood element. We did that in the month of March. Then in the month of April, we discussed the importance of detoxification, because the month of April through the first week of June is the best, most opportune time to do a full body detox. We discussed the doctor-supervised detox program. And now we're moving into the second half of the wood element, which is the gallbladder. So we have the wood element, which is most active in the springtime, and that's your liver initially. Then we move into the gallbladder energy, and so that's where we are this particular month. Gallbladder being the yang portion of the wood element, with the liver being the yin portion. So our gallbladder helps us to make choices and to take action. So lots of planning, which we learned back in March, is what takes place in the liver. Liver helps with all the planning processes associated with making choices. And then the gallbladder is the part of the body that actually activates that choice and helps you to move forward and to take the action that you've been planning for in your liver. So liver and gallbladder work closely together, hence the wood element. And we would like the gallbladder to be functioning quite efficiently. We have lots of problems in this country with gallbladder issues. In fact, there's over 1 million gallbladders get removed in this country every year. And that's because doctors, traditional medical doctors, don't necessarily understand what the purpose of this little sac of an organ does, other than concentrate bile in an effort to break down your fat. But the emotional access, the emotional component associated with the gallbladder has to do with conscious living and taking action to make conscious choices. So we want to make sure that your gallbladder continues to function properly. The other issues associated with the gallbladder, I think I already mentioned. The chief emotion is resentment. meaning life is giving you something that you don't want, but you can't send it back, so you have to deal with it. So we have resentment, we have anger from the liver, then we have being galled or pissed off, stubborn, emotional repression, depression, indecision, irrationality, frustration, and aggression. Those 10 emotions affect how your liver gallbladder system functions. And, we're dealing with being pissed off, stubbornness, emotional repression, and depression and indecision. Those are the ones specifically that impact how the gallbladder functions. So the area is governed in the body specifically by the gallbladder. Your gallbladder meridian starts right here. This is gallbladder 1 point, and it circles back and forth around your head, roughly back and forth 3 times on both sides of your head before it moves down through your digestive system, then goes down each leg, right straight through the center of your knee. That affects your knee joints, and then it goes out through one of your toes. So the areas that are governed by the gallbladder themselves are, we just said, the knee. All knee problems have a gallbladder component. Lower neck, this part of your neck is regulated by the gallbladder. All intervertebral discs. So if you have a disc herniation, I promise you there's a gallbladder component to that. Your ileocecal valve, which is the junction between your small and large intestine. That's one of the most common issues that people have. It relates to the control of the gallbladder. Like I said, it's the junction between the small and the large intestine. And then we have hip joint. And hip joint function related to the femur and how it ties into the socket or the acetabulum. So people who get hip joint issues typically have a gallbladder component. They also have a hormonal imbalance, but that's for a future class that we'll discuss. Muscles associated with the gallbladder happen to be behind the knee, which is a muscle called the popliteus. And when that muscle has difficulties and the gallbladder meridian are having issues related to the center of the knee, that's why you'll develop pain behind the knee. We have the anterior part of your deltoid, and then your primary hip flexor, which is called your iliacus, which sits on the front part of your pelvic bone. It ties in with the iliopsoas muscle. The psoas muscle, which ties in with the iliacus, becoming the iliopsoas muscle, is your primary hip flexors. So people who have difficulty with hip flexion, people who get an anterior hip subluxation, something that I help correct many times over the course of a week in my office. The reasons for that has to do with gallbladder imbalance. So what is the most common symptom associated with gallbladder imbalance? Well, television will tell you. If you get nausea, heartburn, indigestion, upset stomach, diarrhea, those are all gallbladder problems. And they indicate that you have gallbladder stress. You may get pain in the lower part of your right rib cage, just below where the breastbone sits, or where the breast sits on the right side. So you follow that down a little bit to where the rib cage ends. Right in that particular area, you're going to get pain and discomfort. That's typically gallbladder imbalance. But the most common symptom associated with gallbladder imbalances happens to be headaches. Now, those can be cluster headaches, they can be migraine headaches, they could be tension headaches, they could get hormonal headaches. Any kind of headache that you have, any kind, I promise you, it's a gallbladder problem. And if you address the gallbladder, then you can help restore balance and get rid of your headaches once and for all. The circuit for the gallbladder, when the gallbladder goes out of balance, the circuit is going to be your first cervical vertebrae. And coming out right by your first cervical vertebrae is what's called the suboccipital nerve, which comes up over the top of your head and actually ends right about here and here on both sides. So when one gets a headache, typically the suboccipital nerve is involved. Your first cervical vertebrae has gone out of place, and that traces back to the gallbladder being unhappy with probably one of those 10 emotions that I mentioned earlier. The second most common symptom associated with the gallbladder, which we've already touched on, which is based upon that pink liquid that they advertise on television related to nausea, heartburn, indigestion, upset stomach, and diarrhea. That typically is a response due to foodborne illness, what some may call food poisoning. I don't get that extreme. I just say that whatever you ate, your gallbladder didn't like. And so the best, most efficient way to deal with that would be to throw it up. So if you find yourself eating something and then a couple hours later you feel the need to throw up, or you get reflux or indigestion or heartburn or nausea or diarrhea, those are all indications that the gallbladder is upset with what you gave it, and it tried to get rid of it through reflux or throwing it out of the body. And if it can't do that, then it's going to liquefy it and run it out the other end, hence diarrhea. Those are all gallbladder related. Third most common symptom associated with the gallbladder happens to be knee pain. And this has to do with the indecision. If we bring in the kidney associated with it, so fear of stepping forward and fear of making a wrong mistake and fear of moving forward in your life, that will typically create right-sided knee pain. Or it could be left-sided knee pain. Left-sided knee pain means difficulty moving away from something that you need to let go of, and right-sided knee pain is typically flexibility with stepping forward in life, and that sometimes brings in the kidney associated with the fear of making the wrong decision. We have a lot of that going on right now. And so another common issue, which we mentioned earlier, is the fact that they take out over 1 million gallbladders every year in this country. And the question is, well, Dr. Rick, I've already had my gallbladder removed, so what do I need to do to help myself? Well, there are things that we can do to help make your brain think that the gallbladder is still there, because the brain still thinks the gallbladder is there, even though it's not. And you may get phantom symptoms associated with having had your gallbladder removed. Well, we can abate those phantom symptoms by feeding the body the necessary ingredients that help to stimulate normal functioning gallbladder. Okay, and that would be leafy green vegetables associated with the beet leaf greens associated with beets. Beet leaf greens contain an ingredient called betaine, which is actually going to help make the gallbladder function better. So the beet leaf greens, you can eat the beets too, because they actually also have ingredients that help the gallbladder. So the beet leaf greens, which are those stalks that come out of the top of the beets, as well as the beets, those are good for gallbladder function. Another indicator that you may have a gallbladder issue, that your medical doctor may not directly relate to it, is if you have a blood test and they measure your homocysteine levels. People with high homocysteine levels, that indicates that you have gallbladder stress. And there's some nutritional supplements. There's a supplement called AF beta food. There's another supplement called beta food. That's not for your fish. It's actually for your gallbladder. So if you're taking AF beta food, which again has the ingredients, high concentrations of the betaine, that's going to help to keep your gallbladder moving and flushed in a normal fashion. So what are some things for you to consider? Ideally, you want to get your gallbladder checked. We're all a little bit stressed out. Maybe we get a little bit more angry. Why? Because we've been in lockdown. We're not allowed to do the things that we want to do. They're putting in more governmental controls and regulations. And unless you move to, I don't know, states like Florida, where they're fully open, and Texas, where they're fully open, etc. Hopefully, we're all going to be opening up fully shortly. But if you're being asked to do things that you don't want to do in ways that you don't want to do them, that's going to create a little bit of irritation within your gallbladder, and you're going to create gallbladder issues. So what I'd like to offer to you is I'd like to offer to you a free gallbladder check. That would require you to either get on the phone with me, we could do it via video chat, or to actually have you stop into the office. The office address again is 138 Canal Street in Pooler Park. That is in Pooler, Georgia. We're in Suite 404 of Building 400. You can call me directly at area code 845-561-2225, or you can email me at docrick, DOCRICK, at spineboy.com. But either way, if you have any level of gallbladder issues, whether you've had your gallbladder removed or whether you get headaches, any kind of digestive problem that's related to gallbladder, or any kind of knee pain, I would ask for you to please give me a call, send me an email, or stop into the office and let's take care of this. So I want to thank you for tuning in this week. I'm going to ask you to tune back in next week. Same health time, same health station. This is Dr. Richard Huntoon from Advanced Alternative Medicine Center saying, I look forward to supporting you when your health matters.